hospital exposes the apathetic condition of the maintenance in the children's ward of the hospital. The lady here showing bugs crawling under the mattresses of her child's bed. Even the walls of the hospital are not free of nests of cockroaches and other insects. In another case, Nilofar Hospital in Hyderabad is also in trouble now after fungus was found in a bottle of saline solution. The question now is, how can hospitals that are meant to be the most cleanest not get rid of the carrier of germs like pests and cockroaches? Are hospitals efficient enough to cure their patients, or are they hotbeds really for germs and bacteria? Let's go across to Pranesh for more details here. Two cases, Pranesh, that highlight how hospitals need to step their game up. Instead of being clean environments where people and patients get better, they look to be perhaps carriers of germs and bacteria instead.
That's right, Azhar. It's a tragic commentary really on the healthcare system in India, and it just reflects, goes on to show us that how seriously these institutions, organizations, and here we are talking about Safdarjung Hospital, left visuals on the left side of our screen, you can see cockroaches in children ward, and on the right, talking about Safdarjung Hospital, left visuals on the left side of our screen, you can see cockroaches in children ward, and on the right, visuals from Hyderabad where saline bottles have fungus inside them. So this is not a joke by any standard. This is a serious matter and needs investigation, and investigation must be ordered by authorities. We've been trying to get in touch with several of them, but nobody has come forward to take our calls or respond to us, Azhar.
All right, stay with us, Pranesh. We also have Dr. Sanjeev Bagai, a senior doctor, with us. Dr. Bagai, now hospitals, of course, being carriers of germs is a very scary scenario for patients all over the country. Now, do you think most hospitals, private or government, comply with safety standards here? Because we found evidence to the contrary.
Yeah, I think this is one of the most sensitive points in medical treatment. I think it's the duty, it's a paramount responsibility, and it's the accountability of every hospital to give safe and secure environment, hygiene, and aseptic care to any patient. You cannot afford to have any insects and cockroaches and things like that in any ward or any ICU. And likewise, this is a lapse that you have documented any fungus or any other issue with regard to saline bottles or IV fluid bottles. I think the hospitals must come under the scanner for accreditation. Hospitals have to deliver quality. Right. I think there is no compromise on this at all. Sometimes I feel it is better not to give medicine than to give medicine in an environment in which the patient will get hospital-acquired infection.
No, fair enough, fair enough. Dr. Bagai, stay with us. We also have Dr. K.K. Agarwal, former president of the IMA, Indian Medical Association. Dr. Agarwal, would you agree with Dr. Bagai when he says that all hospitals must come under scrutiny for maintaining absolutely A-grade standards? Otherwise, they'd become factories, really, of germs, of disease.
The quantity of care, magnitude of care may differ, but the standard of care has to be same. Safety and quality comes first. Therefore, there is no way you can have a hospital with the unhygienic conditions. If you are seeing cockroaches, they must take action. That has to be taken care of. You cannot have a hospital premises with their multiple patients with unhygienic conditions. Now, regarding fungus in a bottle, there is because every doctor and every nurse, if these bottles get cracked, they may not be sourced. The fungus will never come at source. Fungus will always come at the time of storage. Therefore, every doctor and nurse is supposed to check the bottle for any, and it is very clearly written in every vial, in every injection, and in every bottle. Right. That if they see any turbidity, it has to be discarded, and it has to be notified to the management. So that may not be a negligence as far as fungus is concerned, because that may be a storage where some crack might have come to the bottle. But regarding unhygienic atmosphere, that needs to be taken care of. It's a responsibility.
Fair enough, fair enough. Dr. Agarwal, we thank you for your time. Thank you for speaking to us as well as Dr. Bagai. We'll now take a short break. We'll come back with more on the other side. Stay tuned.